Welcome to this presentation. This is the 22nd in the series of short videos, each featuring 5 multiple choice questions covering diverse unrelated aspects of psychiatry. Each MCQ has 4 options, of which one is correct. Brief information related to the questions will be provided. These are the MCQ topics. Question 1. Which of the following is correct regarding catatonia? There are 4 options. Please go through the options and make your choice. If you want, you can pause while deciding your answer. The correct answer is D. The majority of patients with catatonia do not suffer from schizophrenia. Option A is incorrect because at least 10% of patients with schizophrenia present with catatonic features. However, these features are often missed. B is incorrect because it was in ICD-10 that catatonia was considered to be a subtype of schizophrenia. In ICD-11, catatonia has its own chapter. C is incorrect because lorazepam is the treatment of choice in catatonia. Antipsychotics should be avoided in catatonia due to the risk of neuroleptic malignant syndrome. So the correct answer is D. The majority of patients with catatonia do not suffer from schizophrenia, as more than 50% are due to other conditions. Question 2. Which of the following landmark papers in psychiatry established clozapine's effectiveness in treatment-resistant schizophrenia? For each paper, I have provided the author's name, the journal's name, and the year of publication. Please go through the options and choose your answer. The correct answer is C. It was the paper by Kane et al., published in the Archives of General Psychiatry in 1988, that established clozapine's effectiveness in treatment-resistant schizophrenia. In this study, clozapine outperformed chlorpromazine in treatment-resistant schizophrenia. Paper A showed the effectiveness of lithium in acute mania. Paper in option B introduced the biopsychosocial model, while the paper in option D exposed flaws in psychiatric diagnosis using so-called pseudo patients. Question 3. In psychotherapy, which of the following is the definition of the concept of mentalization? Please go through the options and make your choice. The correct answer is A. The ability to understand and interpret one's own and others' behaviors in terms of underlying thoughts, feelings, and intentions is called mentalization. The other 3 options are also definitions of important concepts in psychology and psychotherapy. The mental discomfort that arises from holding conflicting beliefs or attitudes, often leading to a change in one's thoughts or behaviors, is called cognitive dissonance. The practice of maintaining awareness of the present moment with acceptance and non-judgment is known as mindfulness. The therapist's emotional and behavioral responses to the client, shaped by the therapist's unconscious conflicts and past experiences, is known as countertransference. Question 4. Which of the following is correct regarding functional neurological disorder? Please go through the 4 options and choose your answer. The correct answer is B. FND is at least twice as common in females as in males. Epidemiological studies have consistently shown a female-male ratio of 2:1 or higher. A is incorrect because functional neurological disorder is no longer a diagnosis of exclusion. The diagnosis is increasingly made on the basis of positive clinical signs. C is incorrect because neither DSM-5 nor ICD-11 requires a psychological stressor for diagnosis, which is a shift from older criteria. D is incorrect because treatment of functional neurological disorder is multidisciplinary. Pharmacotherapy addresses comorbidities but not core symptoms. The final question: which of the following is not one of the 4 distinct Humour styles identified and measured by the Humour Styles Questionnaire? Please go through the options and select your answer. The correct answer is B. Sarcastic is not one of the 4 distinct Humour styles in the Humour Styles Questionnaire, while the other 3 are. The 4th distinct Humour style is aggressive. The Humour Styles Questionnaire was developed by Martin and colleagues, and it identifies 4 distinct ways that individuals use humor: affiliative humor, self-enhancing humor, aggressive humor, and self-defeating humor. I have given brief explanations for each type. Those who are interested can pause and note down the details. In general, types 1 and 2, that is affiliative and self-enhancing, are adaptive styles, while aggressive humor and self-defeating humor are maladaptive styles. Sarcasm is a component of aggressive humor, but it is not a separate, distinct style of humor. That brings us to the end of this presentation. Hope you found the information interesting and useful. Thank you for watching.